Section that we're going to be working on is going to be the calf and onto the bottom of the foot. Come on, thank you. Feet up for me, Carter. And down. All right. Can you move over to just my way just a little bit? Yeah, that's good. All right. So, working on the calf all the way into the foot. So, the calf, on the posterior side of the calf is going to be the urinary bladder meridian. Now, we didn't really talk about the lateral side of the calf or the lateral side of the leg or the anterior side of the leg. There's certainly things to be done, but not too terribly much as far as our techniques are concerned at this point. So we're going to focus on the posterior side of the leg. So working down the UV meridian, it's going to be the same thing we've done before: superficial, deep, superficial, general, specific, general, right? No big surprises here. So superficial techniques, we'll do our pressing now. We're working directly on skin, which means we can use both our hands or the back of our hand, whatever you find easiest. Using the back of the hand or the forearm. You could go both directions. We're using very gentle, light pressure. Now, remember the idea behind this is as you're doing your pressing techniques, you're doing a few different things, your pushing techniques, a few things at the same time. One, you're introducing touch. This is getting his body ready for the deeper work that you're going to be doing. Right? Nobody likes it if you just jump in and start pressing. Now, the question comes is how long should you be doing this for, right? Like some people are going to spend a lot of time, 20 minutes doing these sort of introductory techniques. I myself, I'm more in the like 3 to 5 tops, right? I'm going to get down to business. Let's start doing the work. It's up to you. There's not one right answer. What feels best for you? So, number 1, introduce touch. Number 2, palpate. So I'm starting to feel. Remember, when it comes to palpation, is we can palpate a lot by using very light pressure. We don't need to be pushing deep to palpate. Just without going anything deeper than the most superficial level, I can already tell you that right here, there's going to be a lot of tension. There's going to be quite a bit here, a little bit here, and I barely pressed because I'm paying close attention to what I feel. So those are our pushing techniques, right? And we get into our slightly deeper techniques, and in this case, I'll do rolling. And the same thing with rolling. We'll start, doesn't matter which side you start on, right? It's going superior to inferior or vice versa. Anchoring that little finger as you begin, start with a slow rhythm. Facing the table, right? Just getting my slow rhythm down, increase my rhythm. And if that's all I can do, that's all you'll do. That's all you're gonna practice. I don't really care if you move. But if you are comfortable, right? You've got a good rhythm, you're comfortable with moving, then you can start to move down the meridian. That's nice light pressure. If I want to increase the pressure, I just stand up a little bit more. I could go into deeper pressure. Now what I find with deeper pressure is I can't do long strokes with deep pressure. So if I'm aiming for deeper, I'll do a section here, for example. And if I want to move down, I'll shift my body mechanics and start again. Doing okay, Carter? Yes. You could switch with the other hand. So working along the UB meridian now. Right here, that's 57, right? Yeah. 57, yeah. You can find a point and you can do the same thing we did before, which is you can localize your rolling technique there. But this is a great opportunity to start to practice our one-finger meditation technique, which we haven't done a lot of. So one-finger meditation technique, there's a few keys that you need to remember about this, and this is considered a swing technique or moving technique. They got nice and low. You could use a stool if you want to. You could get down on your knee, whatever is comfortable for you. The key is that your elbow is below the wrist. That's a key point to this. You don't want it up like that. So get my elbow below my wrist, pick my point, press my thumb. It's broken down into 2 different segments. We're going to have the roll out and the roll in. Just like with the rolling. Roll out, roll in. But now it's with one thumb. Roll out and in. So when you're starting, that's all I want you to do. Or, see how I'm extending that thumb? Or you can keep the thumb right tucked in. You can almost squeeze into a fist, and you can roll out and in by just rocking over the tip of your thumb. Both totally acceptable, whatever works best for you. But make sure that elbow doesn't raise up. Make sure it's nice and low. You might need to shift your body position, right? Like maybe it's easier to go medial and lateral as opposed to superior and inferior. So roll out and in. Now after you've got a good rhythm going, you can increase the pace and increase the pressure. You're doing okay, Karthik? Yeah. And remember, we would hold this for minimum 30 seconds, upwards of 10 minutes. I've never held it for 10 minutes. A couple minutes at the most. Still doing okay? Is it getting a little bit stronger.
Yeah.
Yeah. So I'm not increasing my pressure at all. I'm staying with the same amount of pressure. But the longer I do it, the more intense it starts to feel. Still okay? So this is a good place to practice that one finger meditation technique. Now it's considered to be a moderate to strong amount of pressure, so we'd get to a maximum of 7, and because we're doing a stronger amount of pressure, we're going to then knead afterwards, right? Then we could do our pressing technique. In our pressing technique, we can work up and down the meridian, so I'm just using palms of my hands, working up and down, very broad. Biggest difference going to be size of contact surface, intensity of sensation. Now we can move into the suppressing technique, and I'm going to use the pads of my fingers, but you could use a thumb saver or any type of tool that you have available as well. So I'll pick a point. We've already done UB40, so that is 57 there, right?
Mm-hmm.
57, yeah. So UB57, I'll press into it, and I'll slowly increase the pressure. And if I want to increase the intensity, I'll go from the pads of my fingers, bring my body up, and lean my body into the point. Dull?
Yeah.
Yeah. Great point for hip pain. You'd be good at releasing hips. Now, so far when we've done our suppressing technique is we really have just focused on points. But this is another great area to emphasize the fact that it's not just picking the points. It's great for specific acupoints, but we can also use any of these techniques along the whole meridian. So I can work up from the Achilles up, doing my deeper suppressing techniques, quite quick. So you notice each time I'm putting my whole body into it. Okay? Don't ever let it get above a 7. 8. We jumped into 8. I could work all the way up the meridian. And if you're working on somebody with relatively small legs, don't use your thumbs, but you can. Right? We could do the same thing. We can reinforce those thumbs and work up the entire meridian. So to simply emphasize the fact that suppressing technique, oftentimes we do use it on a specific point going 7-4, right? But we can use it along the meridian with a rather quick pace. The difference is a yin style or a yang style. Are you going for more nurturing, nourishing, soft, or more of a fast yang sort of energizing technique? All right. Now another technique we can start to do down here is our grasping technique. Really the only other place we've done our grasping technique is in the upper traps, right on GB21. So grasping technique, as opposed to Swedish where we'd grasp and release, it's quite quick. So work on the different heads or the different bellies of the gastroc and the whole thing. You okay? And if you're finding a fast pace is hard, go a little bit slower. That's okay. Still all right? Now this technique, we can go all the way down into that Achilles. So I'll lift that foot up just to get the Achilles a bit bigger. And I'm gonna, you relax, I got you. And I'm gonna squeeze with my thumb and my index, not with my tips of my fingers. So I'll squeeze like this. Go right into the heel. Now one technique we haven't done very much is our friction techniques, or our rubbing techniques. So if I want to warm the area up really quick, I can rub. Or should I add scrubbing? And if you're finding it's uncomfortable on the palm of your hand, you can use the side of your hand, you can go back and forth.
And this has to be done on bare skin, right?
Yes, yeah. That does have to be done on bare skin. It's quite warm now. Yeah. And we could do our percussive techniques. Percussive techniques, you can do your padding, but on the leg, I prefer to do chopping. And in the past, we've done percussive techniques with our fingers. You can, but what I find is if you do that on a gastroc, you can cause a cramp. Every once in a while, when somebody has really tight gastroc, if you hit it with just one finger, like this, the whole thing spasms. So I don't really like to use the fingers here. It's more sides. Okay, and then we can go back into rolling, right? Superficial, deep superficial. So you just back up through all of those techniques. So I've been quite quick, but as always, the amount of time I spend during a demonstration is minimal in comparison to what you should be doing. Practically speaking, if you're doing a whole body routine with Tuina, you don't really do, you'd spend 7 to 10 minutes on the back of one leg. During your practice, 10 to 15, just so you get the hang of it, right? Now, we'll shift our attention very briefly into the bottom of the foot. As far as Tuina is concerned, this isn't reflexology. Now, reflexology is nested within the realm of Tuina, within the realm of acupressure, but it's its own sort of side gig, right? So we're not going to focus on all the different regions and points and how we can affect the entire body through the bottom of the foot. Really, we're focused on only one point. Give me one. That's it. That's the only point we work on. But we have our meridian techniques. So we're not, again, thinking about all the different reflexology zones. It's just that one point. So the one point we use is the same technique we used on the palm of the hand, right? But we'll start by warming up. Now this position that I'm in is not ideal. Typically, I work like this, but I want you to be able to see what I'm doing. So I'll show you my body mechanics, and I'll bring the foot up. So if he's face down, I'll grip onto the ankle this way, and just do my pushing techniques first using the side of my hand.
Now make sure it's not athletic foot.
What, pardon me?
Athletic foot.
If they have athlete's foot, yeah, don't touch.
Make sure it is, right?
Yeah.
You have to check it.
Oh yeah, you certainly do have to do your visual inspection first.
I use the cover.
Yeah.
The sheet.
The sheet, great, yeah. Yeah, so certainly that's a very good point, thank you. Is whenever you work on feet, is part of your assessment process is inspection. So prior to just jumping in, you do a quick look, you'd ask, do you have any athlete's foot or anything like that?
It goes to your hands sometimes.
Yep, it goes to your hand, and then from your hand it could go to your hair, it could go all over, yeah. Yeah, so athlete's foot it's tinea, so it's a fungal infection and it can get everywhere. So certainly do so. And if you're not comfortable working on feet, just fine, no problem. As you said, just wrap it in a sheet. Put something over top of it, certainly. Thank you, that's a very, very good point. That's the last thing you want is to catch something, a skin infection from your client, right?
In country it's dry, so I think it's maybe not so much of
not as much of a problem. Yeah, so it can certainly. Yeah, it's common enough, but not super common. What is quite common in Calgary is ringworm. People have ringworm quite a bit. So ringworm is tinea, but it's on the body. It's a fungal infection on the body. So you want to be careful of that as well. Yeah. All right, so as I'm working on the foot, this is all, and again, I don't usually work up in this position. You can, why not? But typically, I'm going to be working down here or standing at the bottom of the table. Or maybe they're even face up. But regardless, the techniques are all the same. So this is basically just a basic rubbing technique, do a pushing technique. And then when it gets into our deeper and more specific techniques, I do want to put his foot down and I'll stand. Karthik, I need you to flip. I need your feet at the other end for me. Other flip, head down there. Oh, okay, yeah. That's better. So this will make it a little bit easier on me. So standing here, then, I can work on the bottom of the foot. I'm going to use my thumbs in this case, but usually I'll use a tool. You can use your knuckle. Easiest way to find it, we're not worrying about precision, so I'll curl the toes in, and then kind of in the hollow bit right in the middle of the fold, that's where I'll put my emphasis. And I can do my suppressing techniques. You okay? Now that's working on just kidney 1, but I can do that same thing going all the way up the plantar surface of the foot, just like we did up the leg. I would strongly recommend if you do lots of work on feet, use tools. Use tools, because it requires a lot of pressure.
If someone has plantar fasciitis, is this good to do? Could be hurting?
It'll hurt. It'll hurt. But plantar fasciitis, you work here.
Okay.
Because plantar fasciitis, people think it's the pathology is in the fascia. It's not. The manifestation of the pathology, the symptoms of the pathology are in the fascia. But the reason people develop plantar fasciitis is because either, or sometimes both, the calves are tight, because the calves connect into the Achilles, which connects into the heel, which connects into the plantar fascia. So if they're tight, they'll pull on the plantar fascia, but what's more common is to fall on arches. So an arch falls and the plantar fascia gets stressed and inflamed. So yeah, working here is fine, but it doesn't fix the problem. This fixes the problem. right. And then flip over face up for me. Just like we did with the hands on the toes, we can do a pulling technique where you just grip the toes and pull. Right, we could do that twisting technique, which we've done in the past. Each one of the toes, you're okay. And we can do a range of motion to finish off. So we'll grab the leg and we'll just gently rock back and forth like we did. And our shaking technique. Okay. So far so good? All right, give it a try.